Welcome to Shape of the City. I'm Clover Frederick, and I'll be your host. There are many important health topics that come up in our community, and recently a forum was organized to discuss them. Starting this month, the Community Health Endowment hosts its third installment of Community Conversations. To learn more, let's talk with Marcia White, who's Program Manager at Community Health Endowment. Hi Marcia, thanks for coming.
Hi Clover, thanks for having me.
Well, let's start by talking a little bit about the Community Health Endowment and its mission.
Excellent. Well, the Community Health Endowment was organized about 15 years ago with the vision of making Lincoln the healthiest community in the nation. Our primary program is a grant-making program, and over the last 15 years we've returned more than $22 million back to the community in grants. But we also convene the community around critical health issues like safety net services for people who are vulnerable or underserved, and we engage the community in conversations about important health topics.
Well, now tell me a little bit about what Community Conversations is.
Well, we're excited to bring our third series of community conversations to the community starting this month. This is an opportunity for anyone really who's interested in any of the topics to come in, hear from experts or from people who've experienced the interaction with the healthcare safety net or with Lincoln's Human Service Network related to the topic at hand. Our first community conversation series was on health equity and health disparities, and last summer we used the theme My Story, where we looked at a health issue or a social service issue through the eyes of a person who'd really experienced it. It was wildly successful. We had standing room only on almost every event, and those conversations focused on veterans. We had My Story, I came home from war, I am the voice of brain injury, I graduated from drug court, and I am a cancer survivor. And actually, if people go to the 10 Health channel on YouTube, they can see all of those conversations on YouTube. And as I said, they were very successful. In addition to having people who've experienced who have experience with the topic, we encourage people in the audience to interact with the panel and ask questions, and that's really where the conversation part of it comes in. So we're starting a new series this month.
Okay, well tell us what's on the agenda for this month.
Well, because our My Story theme was so successful last year, we're continuing with the My Story theme. We have 4 conversations planned starting on March 3rd. And the first conversation is My Story, I Treated Ebola Patients. We have Kate Bolter, who's the lead nurse in the biocontainment unit at the University of Nebraska Medical Center, coming down. But we also have a couple local experts, Tim Timmons from the Lincoln-Lancaster County Health Department, and Wade Fornander, who's a local family practice physician who treats infectious disease. Now we know that most people in Lincoln probably won't ever be exposed to Ebola, but it's certainly in the news, and it's certainly got people talking about, well, could that kind of an epidemic or pandemic reach Lincoln or touch Lincoln? And certainly with the superbug outbreak in California recently, with talk about the measles, with the fact that this year's flu vaccine turned out not to be very effective or as effective as usual, the topic of infectious disease is really something that deserves the community's attention, and that we think we'll have a good conversation around.
Good. What are some of the other topics we'll hear about?
Well, also in March, on March 26th, we have a topic that's very top of mind for Lincolnites right now, and in a sad way. The topic is My Story, I'm a Suicide Survivor. We've had several very high-profile suicides recently, and in fact the community's convened a suicide coalition to really talk about what can we as a community do to help prevent suicide. Each of our community conversations is done in partnership with a local organization. The first one that I mentioned we're doing in partnership with the Lincoln-Lancaster County Health Department. I Am a Suicide Survivor is in partnership with the LOSS team, and LOSS stands for Local Outreach to Suicide Survivors. And those are people who've experienced a suicide in their own family, who've lost a loved one to suicide, and have use that experience really to benefit others. They're on a team that often goes out with first responders when a suicide is reported, to really be there for the family, offer comfort and support, and connect the family to resources. We know this will be a popular topic. In addition to partnering with the LOSS team, we're partnering with the Nebraska State Suicide Prevention Coalition. So we know there'll be a lot of really valuable information, but we'll also be visiting with people who've lived through the experience and really can relate that experience to others.
Okay.
We have 2 additional events in the series. I Was Homeless. We know that homelessness is something that has a dramatic effect on people's health. And I think people in Lincoln would be surprised when they looked into statistics surrounding homelessness in Lincoln. In a recent 2-year period, a survey indicated that 5,000 people in Lincoln experienced homelessness. And today we have nearly 350 children who are homeless attending Lincoln Public Schools, which presents another real challenge. So we want to convene a conversation around homelessness. What are the impacts on our community? What can our community do to end homelessness here? We're doing that in partnership with the Lincoln Homeless Coalition, which is a group of many organizations that are attacking the problem of homelessness here in Lincoln, and we know those will be very powerful stories. And then our final conversation is on May 20th. The homeless conversation is April 28th. On May 20th, our conversation is I live with mental health challenges. Mental illness affects 1 in every 4 adults in our country, and certainly Lincoln is no exception, but it's really something that we don't like to talk about. We're uncomfortable talking about mental health issues and mental illness, and we have a really outstanding panel of people who do live with mental health challenges coming to talk about that. We're partnering with Centerpoint and with the Mental Health Association of Nebraska. Abigail Swatsworth, who's on staff at Centerpoint, will share her personal story, as will one of the people who works in one of the peer programs with the Mental Health Association of Nebraska. We know that, again, it's a topic that doesn't get a lot of attention, but we feel like it's really important. We know that people who experience mental health challenges also have physical health effects. So we want to make sure that we're talking about all of that. One of our other panel members is the parent of an adult son with mental illness, and just talking about what are the effects on the family. So we think it's a really powerful series, and we're excited to bring it to the community.
Great. Now, how will our viewers find out more about these community conversations?
Well, several different ways.
Okay.
Visit the Community Health Endowment website, which is just chelincoln.org. And if you look on the left side, you'll see a link to more information about the community conversations. We do ask that people register online, and you'll see links to all of those registration pages off the CHE homepage. All the events are free and open to the public. The first and third events, let me check, start at 1:30. And then the second and fourth events start at 10 in the morning. So we try to scatter those around so people have the opportunity to come. So the events are free. There's free parking available here. We do ask that people register online, but we do open them up to the community and hope that people will take advantage of this opportunity to learn about some things that affect health in our community.
Great. Well, thank you so much for joining me, Marcia. Sounds like a wonderful discussion forum. Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com.